Hi, I'm Dr. Greg Castello, board certified family practice, and today we're going to talk about the prostate. So most men have heard of the prostate, but have really very little understanding of what the prostate does, or even where the prostate actually is. So think of your bladder as being a water balloon that's with the neck of the balloon facing down. Your prostate is about the size of a walnut, so take a small apple the size of a walnut and put it at the bottom of the balloon and have the drainage tube of the balloon go through the core or the middle of the apple. That's your urethra, your P tube that goes through your penis. This is where your prostate gland sits at the base of the bladder. The prostate has several functions. It is involved in allowing you to control your urine and relaxing it to go to the bathroom. The other main function is it produces the majority of the volume of your ejaculate. Your seminal vesicles, your sperm tubes, connect into the prostate, and this is how the sperm gets into the urethra for your ejaculate. The prostate can get large and does get large as you get older, and we have what's called BPH, benign prostate hypertrophy, so that means enlargement of the prostate, not related to cancer. Because the P tube goes through the middle of the prostate, if you think of this apple getting bigger, it squeezes on the urethra or the P tube and it makes it harder to go to the bathroom. If you think of a garden hose and somebody stepping on a garden hose, this is what happens with the prostate. So you get a weak stream because it squeezes on the urethra. You get starting and stopping of urine because it's more difficult to push urine through this narrowing. You get decreased emptying of the bladder. So the bladder only empties 50% before you shut off the urine flow. So you fill up twice as quickly, and then you have urinary frequency, so you go more often. You have hesitancy. The prostate helps regulate going to the bathroom, and you have to have your prostate relax in order to go pee, so it may take longer to go to the bathroom. These are all symptoms related to enlargement of the prostate. There's two different types of medicine that we use to treat prostate problems or enlargement of the prostate, and one of them is a class of drugs that block DHT, dihydrotestosterone. This is the chemical that causes your prostate to grow as you get older. There's Proscar or finasteride and a prescription drug called Avodart. These medicines actually over time cause your prostate to get smaller or to shrink closer to normal size. They'll actually lower your PSA, your blood test. So if your PSA was 2 and I put you on one of these medications, not only does it make your prostate get smaller, but it lowers your PSA by about 50%. So your PSA may be 1 while you're on this medication. Because the medications take a long time, 6 or more months, to start shrinking the prostate, they're very slow in their onset of action, so you have to be patient with these medications, and they're used for enlarged prostate. The other class of drugs that we use for your prostate are called alpha blockers, like Flomax, and these medicines actually relax the prostate gland. They don't make it any smaller, but they relax the tightness. So some men may have a normal sized prostate, but it's tighter or more spasm, and that causes a decreased urine flow. So we give an alpha blocker. This relaxes the prostate gland, and these benefits can be almost immediate. You need to keep in mind that the prostate does continue to grow even if you feel better on one of these alpha blockers, so it actually doesn't help protect you from long-term prostate issues if you don't take the other medication. They do make a combination medication called Jalin, which is Avodart, one of the medicines that shrinks the prostate, along with Flomax, the medicine that relaxes the prostate. And this is a good choice in a lot of men because it not only gives you immediate benefits or relief from your prostate symptoms, but also helps slow the growth and reverses the growth of the prostate. There are more side effects when we take the combination medication. You do have to be careful because it does lower your PSA. So if your PSA was 2 and we put you on one of these medications and your PSA went down to 1, if it went up to 2 again, that actually is a doubling of your PSA, and you probably need to see the specialist to discuss this. So even though you used to be 2, you're now 1. That's your new baseline. So going back from 1 to 2, unless you stop the medication, would be considered a doubling of your PSA and might be an indication of underlying prostate problems. So you need to keep that in mind. Your doctor should know this and should recheck a PSA to get a new baseline on the medication. And if that number changes, as long as you're on the medication, you have to go from the new baseline, not your previous number. They can cause some ejaculation issues and other symptoms, but are generally well tolerated. Overall, your risk of prostate cancer likely decreases on these medications, but there may be a slight increase in some of the more aggressive prostate cancer, so you do need to make sure you have your annual PSA on the medication, and you likely are going to be better long term. We think that these medications may decrease your lifetime risk of having to have surgery for prostate enlargement, but we can't confirm this because it may be 10 or 20 years before you would have surgery, so it's a longer term issue. So your prostate gland sits at the base of your bladder. It helps control urination. It can cause urinary problems if it's either enlarged or it's too tight. It contributes to the majority of what you ejaculate. It is a connection from your testicles into your urinary tract to allow sperm to get into the urinary tract to get somebody pregnant. It can get infected, so you can have a prostatitis, which can give you symptoms of enlarged prostate, but that may be more of a temporary issue. Dr. Greg Castello, thanks.